Hey everyone, welcome back to our channel. You know that stuffy feeling when your ears just won't pop or your nose feels completely clogged? It's super frustrating, right? Well, today we're going beyond the usual suspects like allergies and colds to uncover some surprising causes of blocked nose and ears that you might not know about. We're talking about things you encounter every day that could be contributing to this annoying problem. Don't worry, we're not just going to leave you hanging with a diagnosis. We'll also give you some practical tips on how to clear those airways and prevent blockages in the future. So, if you're ready to breathe easy and hear clearly again, stick around, because we're about to clear the air, literally. Let's start with something we all encounter daily, the air we breathe. Now, you know pollution is bad for you, but did you know it can actually clog you up? Think about it. Tiny particles of dust, smoke, and exhaust fumes are constantly bombarding your nasal passages. Your body's natural defense mechanism is to produce mucus to trap these irritants, but sometimes it can lead to, you guessed it, a blocked nose. And it's not just the big cities. Even in less polluted areas, things like pollen, mold spores, and even strong odors can irritate your sinuses and lead to that stuffy feeling. Recent studies have shown a direct link between poor air quality and an increase in respiratory problems, including nasal congestion. One study published in the Journal of Allergy and Clinical Immunology found that exposure to traffic-related air pollution significantly increased the risk of developing chronic sinusitis. So what can you do? Well, staying informed about air quality in your area is a good start. You can also invest in an air purifier for your home, especially if you live in a polluted city or suffer from allergies. And of course, don't forget to change those air filters regularly. Okay, this next one might surprise you. Jaw problems, specifically something called temporomandibular joint disorder, or TMJ, can actually contribute to blocked ears. Now you're probably thinking, what does my jaw have to do with my ears? Well, the temporomandibular joint, which connects your jawbone to your skull, is located right next to your middle ear. When this joint is out of alignment or inflamed, it can put pressure on the eustachian tubes, those tiny little channels that regulate air pressure in your middle ear. This pressure can lead to that blocked, muffled sensation we all hate. So how do you know if your jaw is the culprit? Well, common symptoms of TMJ include jaw pain, clicking or popping sounds when you open and close your mouth, and even headaches. If you think TMJ might be contributing to your ear problems, it's important to see a dentist or oral surgeon who specializes in TMJ disorders. They can recommend treatments like jaw exercises, night guards, or even in some cases, surgery to help realign the jaw and relieve pressure on the eustachian tubes. Chapter 3. We all know staying hydrated is important, but did you know it can actually impact your sinus health? When you're dehydrated, your body produces thicker mucus, which can clog up your sinuses more easily. Think of it like this. Mucus is supposed to be thin and watery to help flush out those irritants we talked about earlier. But when you're dehydrated, it becomes thick and sticky, making it harder for your body to clear it out. And it's not just about how much water you drink. What you eat can also play a role. A diet high in processed foods, sugar and dairy can actually increase mucus production and inflammation in the body, including in your sinuses. So what should you be eating? Well, foods rich in antioxidants like fruits, vegetables and green tea can help thin mucus and reduce inflammation. Spicy foods like chili peppers can also help clear out the sinuses, but use them in moderation. And of course, make sure you're drinking plenty of water throughout the day. Aim for at least 8 glasses a day, and even more if you're exercising or live in a dry climate. Chapter 4. We all experience stress from time to time, but did you know it can actually manifest physically, even in your nose and ears? When you're stressed, your body goes into fight or flight mode, releasing hormones like cortisol and adrenaline. These hormones can trigger inflammation throughout the body, including in the nasal passages and eustachian tubes. Stress can also cause muscle tension, and believe it or not, there are muscles in your head and neck that can affect your sinuses and ears. When these muscles are tense, it can restrict blood flow and contribute to that blocked-up feeling. So, what can you do to manage stress? Well, there are a lot of great techniques out there like deep breathing exercises, meditation, yoga, or even just taking a few minutes each day to do something you enjoy. Finding healthy ways to manage stress is not only good for your mental health, but also for your physical health, including the health of your sinuses and ears. Chapter 5. Hormones play a crucial role in regulating many bodily functions, and you guessed it, that includes the health of your sinuses and ears. Hormonal fluctuations, especially in women, can sometimes lead to nasal congestion and ear blockages. For example, during pregnancy, increased estrogen levels can cause the mucous membranes in the nose to swell, leading to a stuffy nose. Similarly, during menopause, fluctuating estrogen levels can also cause nasal dryness and congestion. But it's not just women. Men can also experience hormonal changes that affect their sinuses. For example, low testosterone levels can sometimes contribute to nasal congestion. If you think hormonal changes might be contributing to your blocked nose or ears, it's important to talk to your doctor. They can help you determine the underlying cause and recommend appropriate treatment options, which may include hormone therapy or other medications. So there you have it, 5 surprising causes of blocked nose and ears that you might not have known about. Remember, these are just a few possibilities, and it's always best to consult with a healthcare professional for proper diagnosis and treatment. If you're experiencing persistent or severe symptoms, don't hesitate to reach out to your doctor. They can help you get to the root of the problem and find relief. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and insights. See you next time.